Assalamu alaikum everybody. My name is Syeda Alisha Farwa and I'm a student of MPhil Psychology, Fatima Jinnah Women University. What I am doing today is I'm going to be presenting one of the theories of health psychology to Dr. Iram Gul. That I'm going to present is Transtheoratical model. So let's move on to the content of this presentation. What we are going to cover today. We are going to be covering history and origin of this particular model. We're going to be covering the definition, the core concepts, latest case studies, outcome of this model, criticism on it, and lastly, the conclusion. So these are some of the topics that we're going to cover. So moving on to the first topic of this presentation, that is the history and origin of this particular model. This model was developed by James Prochaska and Carlo Di Clemente during the late 1970s and early 1980s. Initially, in the study of smoking cessation, they have noted that people did not simply alter their behaviors but go through a sequence of steps, and thus this stage resulted into the formation of what has since been referred to as stages of change model. Informed by several psychological theories such as behavioralism, cognitive psychology, and humanistic ones, this model presents five stages, including pre-contemplation, contemplation, preparation, action, maintenance, and some of its variations have the sixth stage that include termination. This model is particularly called theoretical because of the psychological theories we have already discussed. And beside these stages, the model has some major constructs, including decisional balance, self-efficacy, processes of change, and since its creation, the model has become one of the popular models in health psychology because the model has criticized the previous models and it has some steps that are latest and new to this study of like the domain of psychology. Moreover, it's not just that this model has also been criticized because it has the possible tendency of simplifying complicated behaviors and perceiving people to have stages that can be moved in a linear manner. It is, however, a fundamental text on how to support and comprehend health behavior change. So yeah, let's move on to the next thing. So the next we have is the actual study, which was conducted by Prochaska and Welser, one that I've used. This study is called the Transtheoratical Model of Health Behavior Change, and this include all of the things that they did, the population they studied to develop this particular model. Moving on to the definition of transtheoretical model, we have already introduced the transtheoretical model, what it is particularly, and what it impact, like how it impacts a human body and its processes. So basically, it is also known as stages of change model because it has some stages. It like a lot of health psychology theories and models have different kind of processes and they either overcomplicate things and describe things, but this particular one has made like have categorized the changes that human experience or the way our behavior can be changed into different stages. So this is why this model is particularly called trans-theoretical, meaning different theories or the stages of change. Changing the behavior model. So yeah, let's move on to the next thing. Now we are going to see these are the core concepts that we are going to discuss, and this is going to cover the main part of our presentation: stages of change, processes of change, decisional balance, self-efficacy, and temptation. You guys might have already know some of the things, and some of the things that we are going to introduce in the later domain. So let's get on to it. The first important construct or concept of this particular model or theory is the stages of change model. The stages of change, the stages. These are the stages this whole model is based upon. So the first stage that this model introduced to us is the pre-contemplation. Pre-contemplation is the stage when the client or the person has zero intention to change its behavior. It's mostly oblivious that it even has a problem. For example, a chain smoker who does not even recognize how his habit of smoking is affecting himself and the people around him. So that is the pre-contemplation state, like they have not even started to think about. And usually in this stage, the friends or the family encourage or motivate the person to change their behavior. The next stage we have is contemplation stage. This is a stage when they become aware that they have the problem. Like the previous stage, they had no knowledge about it, but in this stage, they know that they have a problem. But the issue here is that they are not committed to it. They are not ready to change themselves, and they're not even mentally prepared. They just know that they have an issue, and that's it. Next, we have the preparation stage. Preparation, like the name suggests, now they are thinking about, that they should take an action, but that is only thinking. They are not doing anything in action, not in practical. They're just thinking. So then comes the important stage, action stage, of course. This stage is like its name, action. It pushes a person to do the particular thing. Now they're going to, and they're trying to do the thing. They are trying to modify their behavior. They're trying to take actions. They're concerning, different kind of psychologists. They're considering their advices. They are considering their friends and family and their support circles advices, and they're changing their behavior. Next step we have is maintenance. Like, they didn't think about it, then they thought, they started taking action. Now the stage is about maintaining the behavior. So now maintaining means do not changing it, not going reverting back to the same thing, to having the same behavior, and replacing the old one. Usually staying longer than 6 months. If the behavior stays longer than 6 months, it is said that they have maintained the behavior. And then comes the last stage, which in some variation is known as relapse, in some variation is known as termination. So, this particular stage, if a person goes back to their past behavior, is known as relapse. But if the person has maintained this entire new behavior, has quit smoking, for an example, then it's called termination. So, recycling, because they are going to go back to the same cycle. They're going to, after the relapse, they are going to go back to the pre-contemplation stage. So yeah, if they end the past behavior, the troubling behavior, for example, if they were smoking and they have stopped smoking, they have quit smoking for good, then it's called termination stage. And if they have not, then it is called relapse stage because they have reverted back to their problematic behavior. Now, this pain spiral model or design is actually used to refer to this particular model. Like, this is the main design that is used for this particular theory or model of health psychology. You can see that they're starting from the pre-contemplation, and then they are going to the contemplation, preparation, action, and usually they'll be the same thing because usually action is not sustained. So they go back to the pre-contemplation, contemplation, preparation, then action, and then maintenance. And if this is maintained for a longer period of time, it is terminated. So yeah, let's move on to the next slide. Now we are going to use this model in strategizing or in intervention. So what's happening now is that in the first step, pre-contemplation, what is usually done as an intervention is educating the person about their behavior and that their behavior is not beneficial, and if they're going to change it, what kind of the outcomes they are going to experience. In the contemplation stage, we usually address concerns and identify support systems. In preparation stage, we help them establish realistic goals and timelines for change, provide positive reinforcements. In action stage, we provide we we are present there, we provide positive reinforcements, we monitor them, we check them. So there are a lot of things going on in the action stage. And then the last stage, maintenance and relapse and termination stage, is when we provide them encouragement and support. So moving on to the next thing, operational steps in transtheoretical model intervention. So the first step is specification of target population and their behavior. So for an example, they have they are smoking. So we have decided that we have to reduce their habit of smoking from 150 cigarettes a day to half of it a day. So we have specified this behavior and we are going to reduce it because behavior change is a complicated process. It's influenced by environment and it cannot be changed in a second. It usually takes time. So that is why we consider that example. We can obviously use any kind of other example depending on the context of it and depending on the scenario of it. Then we will do a baseline diagnostic evaluation. We can use different kind of inventories like decisional balance inventory, processes of change scale. We can do self-efficacy tests and different kind of inventories. Then stage assignment and triage. We are going to assign the stage based on the previous evaluation that this person is on. We will assign them a stage. For example, some people are already aware of their problem, so they're on contemplation stage. Some people don't even know that they have a problem, and their peers or their family introduce them to that problem, so they're on pre-contemplation stage. And if they are already trying to take action, so we will assign action stage to them. So after selecting the stage, we are obviously going to, you know, uh, tell them about the strategies of that stage. For example, if they are on preparation stage, we will help them and we will say that, okay, if you're ready and if you're going to do X thing, then Y thing will happen. And we are going to basically make up their mind and we are going to help them move from preparation stage to action stage. And if they are on the action stage, we're going to help them by saying, we're going to provide them positive reinforcement, like you've done a good job, nice work, or different kind of other things. Like we are going to provide them logistics, sports, and related things. So yeah, moving on to the next stages, we're going to give delivery logistics. Delivery logistics mean we will provide them face-to-face counseling, proactive mailing, expert system checking. We're going to provide them peer grouping or mobile applications to monitor their own selves or, you know, for a one-on-one connection. And then the sixth step, monitoring and dynamic tailoring. We are going to monitor their progress and we are going to obviously tailor according to their dynamics. We are going to change things according to their changing dynamics. We are going to keep a guard on their progress to know what is happening and how much they have progressed. Handling relapse, the seventh step, which means that if they go back, revert back to their actions and somehow are unable to maintain their behavior because this theory is all about repeating the cycle. It's a spiral and it goes on and on and on until the behavior is terminated. until the previous behavior is terminated and the cycle ends. So, if the person repeats the behavior, then we tailor the interventions, we repeat the same thing and go back to it. Lastly, evaluation. We compare the progress of the person with the actual model. So, what we have discussed so far is the actual steps of or the stages of the model, how we can use it in an intervention, and how operationally, step by step, this model is used in an intervention. So, moving on, we have the processes of change. Obviously, this is a model about stages of change of behavior. So, obviously, when we are changing the behavior, there are going to be different processes that a person is going to experience. And as you can see on the screen, there are like different kind of processes happening. Like on pre-contemplation stage, we have consciousness raising, environmental reevaluation, romantic relief, social liberation. Then in contemplation, we have self-evaluation, self-liberation, help in relationships, counter conditioning. And in maintenance stage, we have reinforcement, management, stimulus control. And these three things, pros of changing increasing, cons of changing decreasing, self-efficacy increasing. These three things are about the other two concepts that we are going to discuss that are I'm sorry, that are pros and cons of decisional balance and self-efficacy. So yeah, let's move on to further details of these concept of process of change. So these 10 processes of change show the cognitive and behavioral approaches that people use to guide them through the stages of change. The cognitive and affective processes are mostly involved in the initial stages, but in the consequent stages, such as action and maintenance, behavioral mechanisms such as rewarding, supporting, and controlling the environment and more are dominant. Prochaska and others stress that the point that behavior change practices are more effective in the case when they are aligned with the stages of change in a person. So these are the 10 stages of change we're going to discuss one by one. First thing that we have is consciousness raising. Obviously, when the person gains information, their consciousness is raised. They are more aware of it. It's just consciousness here, but obviously its full name is consciousness raising, because obviously their consciousness by the name it suggests is increased. Then we have dramatic relief. It is the experience of great emotions with regards to the issue and possible change. Then we have self-reevaluation. A person reevaluates its identities and values, befitting and changing their behavior. Then environmental reevaluation. It is the apprehension of the effects that the behavior has on others and vice versa. Social liberation is the acknowledgement of social support and changes in general that support the healthy behavior. Then, moving on to the next five behaviors, we have self-liberation, the knowledge of possibility of changing and willingness to do it. As support seeking support from peer group, counter conditioning, a replacement of bad habit with better ones, reinforcement management, the application of rewards in order to promote changing in a positive direction, stimulus control, the control of your environment using reminders and cues. And not just that, the process of change, other researchers have presented even different strategies and processes that are involved. For an example, Bartholomew et al. In 2006 presented additional 21 processes or stages or strategies that are used in this entire process of behavior change. Some of these include comparison of risk, positive framing, which is the stress of success and failure, self reflection, consideration of individual risk, modeling, goal setting, and coping skills. So, yeah, processes of change, as you all know, are the processes, different things that a person experience when they are going through the different changes in their behavior. And as I've already said, our behavior cannot be changed in a day or in a second. It's a complete process, and everybody experiences it differently on different levels. So, obviously, these 10 processes cannot be it in explaining our behavior change. There are definitely other processes as well. The next core concept of this model is level of change, relating to the processes of change. When you're going through the changes in your body, you definitely experience different kind of things. And obviously, these are the complexity a person faces, and there are five different levels from simplicity to complexity. And the therapeutic modalities depend on the level of complexity you're on. And most importantly, according to one study, these levels were not very useful in determination of whether an individual would discontinue therapy early or not. However, Prochaska and Norcross 2005 stressed that it is crucial that both clients and therapists agree on the degree to which a problem belongs and to where they want to devote their energies to. So, depending on that, they have these five levels of change in their study, which you can also see for yourself. These include situational or symptom based problems, maladaptive thoughts, interpersonal issues, the family or system based conflicts, and deep long term internal differences. So, moving on to the next important thing or construct of this theory is temptation. Temptation, as you know, you already have heard of it. This is a sign of how strong a person's impulses are to commit their behavior. Temptations are usually the urges, the cravings a person has, and the desire to go revert back to the same action. These are the impulses. If you have known about, if you have studied the Freud's theory, you have the eros and the thanatos, and you have in that same theory. Yeah, I'm sorry about that. In that same theory, we have basically. Apologies for my sick behavior. I apologize. As I was saying, that in the Freud's theory, about Eros, Thanatos, and there's particular concept about id, unconscious. So, just like that, temptations are the strong impulses to commit on specific negative behavior that you guys, like the person, not you guys, the person, particular person has been doing. And the most three important factors that actually influence the most include emotional distress, which means emotionally stressful situation, positive social situations, which mean encouraging social situation. For example, you are habitual of smoking and you're in with some peers of yours who are smoking and they encourage you to smoke. And even if you are trying to quit smoking, obviously, with their encouragement, you will be willing to smoke. And then, lastly, the most important factor is craving, the desire or just the hunger to or the urge to smoke or do the particular behavior is one of the things. So moving on to the important next concept, that is self-efficacy. It is completely opposite to that of temptation. There is temptation on one hand, and then there is self-efficacy on the other. Self-efficacy is Bandura's concept. Like temptation was one of the Freud's concept, like it was interlinked with Freud. But this is Bandura's concept. So this is how much confidence a person has within themselves about themselves, uh, that they believe that they can do a particular thing. Their self-confidence about how much they can do a particular thing, and you know they can continue doing it. So if they have higher self-efficacy, there's a higher probability that they're going to change their behavior. And if they have low self-efficacy, then obviously their self-confidence is low. So there is a less probability of them carrying out that behavior. So when we are also revising the intervention, it's important to note their level of self-efficacy, which we usually test in the, evaluation stage, or sorry, not evaluation, in the assessment stage, where we check and monitor the self-efficacy levels through different scales or tests to know how much self-efficacy, self-confidence they have about doing a particular thing. So I've given an example in the slide, that is, if a person is exercising for 3 months and is more confident, then there is a high probability that they'll keep on doing it even when the life gets busy. Now, moving on to the one important concept of this particular model, that is decisional balance, weighing the pros and cons of behavior change. This is a balance sheet, to weigh the consequences and to know what's right and what's wrong. And these varies to different stages. For an example, in the pre-contemplation stages, there are more cons and less pros, and this is how they are perceiving the pros and cons. In contemplation or preparation stage, pros equal cons, and in maintenance or action stage, the pros are higher than the cons. Yeah, now we are going to discuss the latest case studies in this field or in this model. In the latest case study, one of the latest case study include a study by Freckles et al. And it is an RCT which is done on, which is conducted on Brazilian population, and it's about weight management, and it has shown incredible result even now. It was done in 2020. You can go and see for the whole study for yourself. Next, we have a study by, Dunkel et al. And it was also conducted in most probably 2024. And Wupin et al., sorry, Wupin et al. And or Dunkel et al. It was conducted in 2024. And it was a controlled trial in German population, type 2 population, and type 2 diabetes patients about life intervention on self-efficacy and life management, because type 2 diabetes, diabetic patients have to take on interventions. As I was saying, that the type 2 diabetes patients and don't have a particular treatment. It's one of the chronic diseases or illnesses that cannot be directly treated like normal illnesses. So in type 2 diabetes, a person usually has to uh, go through a lifelong lifestyle modification intervention, that they have to adopt particular habits, new habits in their life, and they have to manage their life thoroughly. So they employed theoretical model in their lifestyle modification intervention, and the results were quite interesting, and you can check this study out as well. Next, we also have a randomized controlled trial on the metabolic syndrome. This study was conducted in Kenya on 352 adults, and this study also was used to check the effectiveness of transtheoretical model-based health education intervention, and it was assigned to either standard cardiovascular disease care or trans-theoretical model-based lifestyle modification intervention over 12 months period. And this was done by a QB and Kimani et al. In 2024. So it's like it was just done last year, one of the latest studies and on 352 participants. You can check it out. This also showed that how influential health education interventions still are, specifically how useful this model is even today. So yeah. Now we are going to discuss the outcomes or the benefits of this particular model. So obviously this is really effective in smoking cessation studies because it was obviously conducted on it as well. It's really efficient in weight management, stress and depression management, early stage behavior change management, medication adherence, and even sustainable travel behavior change, promoting sustainable and travel behavior. So yeah. Now, coming back to the criticism on this theory, there are particular things that this particular model left out. One of the things is methodological limitations. It does not have like effective methodological implications, like there are some limitations in re-implementing the behavior from one study to the other. For example, the literature upholding TTM is characterized by a prevalence of cross-sectional design, which restrict the possibility to establish causal relation and support the premise that underlies the trans-theoretical model, namely the sequential development of the stages. And then we have arbitrary stage boundaries. We have lack of standardization. West and West has said that this particular model has not West like the West 2025. This particular author criticizes theory as the assumption of rational planning. It's really rational, not emotional, and it has inconsistent application and limited effectiveness. And some other criticism include that it has oversimplified this particular model, has oversimplified the changes or the behavior processes that a person experience. Behavior change is a very complex process. It's like I have already said, it's not a thing to change within a day, but it usually takes time, especially for the things that these interventions are used for. We're not talking about just small behavior change. We're talking about smoking. We're talking about alcohol addiction. We're talking about different kinds of addictions. This particular theory or model has oversimplified the entire process of changing behavior, which is highly criticized everywhere. So now coming back to its conclusion, even though this whole model is oversimplified and it has some, criticism, but which theory does not have criticism? Every theory has it. Compared to the other theories, it's a pragmatic and tailored framework. It supports short-term change Obviously, it requires full implementation. Behavior change is not magic. It requires demands attention and consistency. And obviously, context matters and ongoing support in all behavior is required, whether it be alcohol addiction, weight management, diabetes management, or smoking cessation. So it's best for, like I've written here, intentional behaviors and incremental change, which and it usually is focused on weighing cost and benefits. Now I have added uh, some references from where I have taken the data from. And lastly, if you have any question, you can comment them down because the video is large. I will have problem sending it directly via mail because the file is large. It will take a lot of time or a lot of efforts, and and it will be difficult to manage because it can be corrupted as well. So I will upload it on YouTube. You can comment down your question, my class fellows. You can comment down your questions, and you can even share your question in the class groups. And thank you so much, and take care. Bye bye. Thank you.